Hello, everyone. Thank you for joining me today. My name is Kenny Lowe, and I obtained my bachelor's degree from the University of California, Davis. I am currently working as a clinical research coordinator at Integrative Skin Science and Research. My presentation today is on how systemic doxycycline reduces eicosanoid levels in the tear lipidome of patients with ocular rosacea. And this is the results of a controlled trial. As many of you may know, rosacea is a very common inflammatory condition with multiple subtypes, including cutaneous and ocular rosacea. One of the common treatments for rosacea is tetracyclines, including minocycline and doxycycline, due to its anti-inflammatory properties. However, the effects of these treatments are still unknown on the tear lipidome and lipid mediators. The goal of our study is to investigate the effects of doxycycline on the tear lipidome in individuals with cutaneous or ocular rosacea. This study was conducted on 21 adult patients with ocular and/or cutaneous rosacea who received and took 100 milligrams of doxycycline twice daily for 4 weeks. A control group comprised of subjects without rosacea was used for comparison. Both the control and treatment group were seen at baseline, with the treatment group returning for a week 4 visit. Eye and skin lipidome and microbiome collection was performed at baseline for the control and treatment group, and again for the treatment group at the week 4 visit. So taking a look at this first set of data, we analyzed and compared the lipid profile of the control group versus the treatment group at baseline and at their week 4 visit. Some significant takeaways from this data include some of the lipid mediators in subjects with ocular rosacea normalized after being on doxycycline for 4 weeks. For example, in cluster 4, the lipid mediator C decreased and normalized in the treatment group to what is normally seen in subjects without rosacea. Another example is in cluster 6, where 15-HEAP also normalizes in the treatment group to a similar level as the control group. Some of the lipid mediators also increased or decreased significantly and strayed farther from the normal after treatment with doxycycline. This next set of data shows several of these changes. Some of the figures show a significant change in the amount of lipid mediators seen after taking doxycycline. While there is not enough research to indicate if these shifts are beneficial, we are able to deduce that the use of doxycycline does affect the eicosanoid levels in tear lipidome. So to reiterate, our conclusion from conducting this trial suggests that there is a significant change in the tear lipidome and lipid mediator profile in patients with cutaneous and ocular rosacea. When subjects were treated with doxycycline, the clusters of lipid mediators were affected and some normalized, while others strayed farther away in comparison to the control group. While we do not know the significance or the benefits of these changes, this study does allow us to question what treatments may affect our tear lipidome, and that further research is required to fully understand the effects of these changes. And that brings us to the end of this presentation. If you have any questions regarding the study, please do not hesitate to reach out to me via email. Thank you for your time.